Welcome to the Really Know Your Customer podcast with your hosts, Betsy Westhafer and Tony Bodoh. Join Betsy and Tony as they dive in with highly successful C-suite leaders who have grown successful organizations by creating a laser focus on listening to their customers and building deep customer relationships. Now, it's time to join Betsy and Tony for the Really Know Your Customer show.
Hi, and welcome to the Really Know Your Customer podcast. I am Tony Bodoh.
And I'm Betsy Westhafer, and we are really glad you're here today.
Today, our guest is Dr. Munsch Dal Farra, and I'm really excited about this interview because Dr. Lauren is going to take us through how she has built a holistic practice that focuses really on understanding healthcare from a relationship perspective as opposed to a transactional perspective.
So excited for this interview, Tony. It's such a time of really evaluating one's health with everything that's been going on. And I've been digging into a lot more detail, and just what her organization offers is so exciting, and the approach they take. So I'm really looking forward to diving into this one.
Absolutely. And I love that we have this opportunity to look at healthcare as we're going through this, the COVID-19 crisis, the pandemic, because there's been a lot of changes very quickly in a lot of businesses, and healthcare is at the forefront of that. So I know we're going to dive into some of those topics as well.
Absolutely. So without further ado, Lauren, welcome to the Really Know Your Customer podcast. We're so glad you're here.
Thank you so much for having me.
Yeah. So Lauren, just to let our audience know, you are the CEO and a cardiologist, the CEO of Palm Health, which we're going to get into a discussion about what you guys do there and how you do it, more importantly. But tell us more about your career path and how you, as a medical doctor, have now become a CEO.
I'd be happy to. My background is similar to most physicians. I went to medical school here in St. Louis, where I grew up. I went on to do an internal medicine residency at Washington University School of Medicine here in St. Louis. And then I went on to do a cardiology fellowship at New York in Mount Sinai Hospital. And along that path of my traditional medical training, one of the things that really stood out to me was that, patients would come in kind of again and again with the same symptom, the same problem, in that our system didn't really have a means of being able to address the root cause of that problem, nor did we have a real comprehensive platform to not only give patients the tools and resources to change their lifestyle in a meaningful way, or to develop an elevated level of consciousness that helped them change their behaviors, but we also didn't have a platform to build relationships truly with our patients. And so that is what led me into creating Palm Health, which is really the outcome of something that I wanted to provide patients as a physician, and something I would want to experience as a patient as well.
So tell us at a high level about Palm Health and why it's different.
Palm is an integrative medicine and wellness center where, under one roof, we combine a multi-specialty medical practice. The backbone of that practice is our primary care physicians. And what is unique about those primary care physicians is that they are also trained in functional medicine, which helps us really develop skills and tools to get to know our patients in their at a genetic level, behavioral level, how their mind is working together with their body, look for root causes of different disorders and illnesses, and then put together comprehensive treatment programs. Also within Palm, we have a comprehensive component of experts in fitness, nutrition, coaching, counseling, as well as the lifestyle platform of a personal training gym and fitness studio, movement studios, a number of different wellness therapies, and then a healthy cafe to help support people in their nutrition.
It truly a lifestyle approach to it, which I love that idea, because one of the biggest challenges that, I've seen when I've worked with other medical practices is that being able to go from one specialty to another means I typically have to leave the building, set up appointments, go through the whole process again and again and again. And it could be in different areas of the same city. It could be in different cities, depending on what I need to get to. And so what you're providing is just so revolutionary in the medical space. I think, well, we say revolutionary today, but it will be evolutionary from the perspective that a lot of other companies and organizations are going to move that way. So talk to us a little bit about this idea. It was one of the things that I think really moved you also in this direction, which was healthcare is often like transactional. And you were sharing with us how for in your mind, it's really about a relationship with the patient.
Yeah, I think so much of the different illnesses and conditions that our patients are dealing with today, the root of those problems are lifestyle and stress. And to really get to the root of those problems and help address them and help people make meaningful changes in their lifestyle, we really need to know our patient at a deeper level. And, part of that knowing our patient piece comes really simply into the fact of having the time to spend with them, having the time to listen to their stories, having the time to hear where have been the obstacles in their ability to make substantial and sustainable changes in their life. And our medical system, in the way that I was practicing, allowed for no more than 10 to 15 minutes with a patient. And that wasn't enough time to help me understand not only why did they have high blood pressure, but why weren't they able to consistently take their medications or change the way that they were eating or address all the different mixed messages that they were getting in the community about how they should be eating and how they should be exercising. And so not only was there a lack of ability to really connect with my patient, but the fragmentation in the lifestyle and wellness space of all the different messages ranging from, you should fast for 18 hours a day to you should eat every 2 hours to keep your metabolism going, was so fragmented that I wanted to put together a team of experts across nutrition and across fitness and across coaching and counseling and mental health that allowed us to really comprehensively be an expert in that space and then customize our recommendations to the individual so that they were getting the best plan that met their needs based on their individual circumstances, and not have so much noise and confusion amongst the different recommendations that my patients were getting.
I think that's so key. There are so many messages. And of course, with the internet, Dr. Google can really mess people up as far as being able to access so much of this information that may be completely irrelevant to their own healthcare. But what really strikes me is, in our vocabulary, we talk about patients, but you're a CEO and these are your customers. And that's why it's so exciting to hear you talk about really knowing your patients, because the equivalent on the business side is really knowing your customers. So talk to us about just your mindset as a CEO and how, obviously you have a very big commitment to your patients, but how kind of tactically you get to know your patients at a really deep level.
So our process is unique for a medical practice in that first encounter with Palm Health starts with somebody who's called a navigator. And our navigators, most of our navigators are trained actually as well-being coaches. And so their background is really understanding how to look at and talk to a person and develop that relationship and understand what their needs are. Why did they walk through the door today? Are they looking for a proactive approach to prevent a problem? Did they just get hit with a major life diagnosis and they're looking for all the tools and resources to, address that and improve the quality of their life and the quality of their condition? So our first interaction starts with a navigator that really works to identify our clients' goals and what it is that is motivating them to come into, a place like Palm Health. Are they more interested in the lifestyle components or the access to a medical team that will call them back for all their acute needs on a very timely basis and help them put together a personalized plan? And once our navigators go through that process and really identifying our clients' goals, they help match them with the medical provider if that's something that they're interested in, that would be best suited for them. Often they do a meet and greet with that medical provider, which is like a mini consultation, just to make sure that each side feels like they're a fit for each other. So, oftentimes someone might come in and initially, based on what they've said, they might fit in one box, but when you really get to know them and we understand that they, are really busy in their life and they need to have appointments that are outside of the traditional clinic time and have someone available for them on Saturdays or after hours, that might be a different provider. So everyone's needs are so varied. And it really starts with understanding what's going to be the support that will make this relationship successful. And then we also need, those navigators need to know our different providers so they can make that best match. And then once that match happens, that navigator is there for helping optimize the experience for the patient or the client, and making sure that if there are, issues that come up along the way, that they feel supported and that they always have a place to turn to through each, step of their path with us.
I love that approach because it's really like having an account manager for a patient, where you've got somebody quarterbacking all the services, looking for, red flags, all those kinds of things. And I just really, really love that approach, especially, as somebody who's been there trying to do the navigation myself, to have somebody that really understands the infrastructure and the network and the ins and outs of all of this, to have that navigator, I think would be a tremendous asset for your patients.
Yeah, and it's the number one thing that we hear over and over again from patients is how important that navigator relationship is to them. And our patients also form, very strong connections with their physicians, with their personal trainers, with their massage therapists, with their counselors. But knowing that there is, a single point person for them to contact and, help kind of keep a pulse on all those different recommendations and navigate the system, so to speak, is a tremendous benefit.
One of the things that allows you to do this is the way you're set up. You're not just a practice that has a lot of different specialties, but you actually are a membership-based organization. So talk a little bit about why you decided to go that way and how that's benefited your members.
We decided to take a membership-based approach really because of two factors. One, it allows us to keep the level of quality at the level we would want to deliver for patient care. So, and how it does that is it really allows us to, take all these services that insurance doesn't reimburse for, including kind of that coordination piece, really understanding the wellness recommendations that are coming through, helping people follow through with their plan, being a point person to help people, hold people accountable. All of those soft skills that, are not transactional in patient care. That's what that program is there for. So our physicians, want to make sure that they're in a relationship that is two-way. This is not just about our physicians giving recommendations, but they're giving recommendations to people who want to make substantial lifestyle changes, or who've made substantial lifestyle changes and want to maintain them, or who are already living very healthy and want to keep, that health and safeguarded, or, who really want to understand what is the best way to maintain comfort and quality through a significant new diagnosis or an old diagnosis that's come back. That spectrum is so varied across our patients that the skills that are necessary and the support that's necessary to be there for our patients in all those different ways requires a pretty substantial team of people to take care of them. And really, when they're committing to something like a membership program, whether it's a 1-year commitment, they're also making that kind of investment into their own health, and there's a motivation for them to also give to that relationship. And then it becomes something that they want to, be accountable toward. And I think, you see that often with people who take a personal trainer. Might not necessarily need to be because they need the same trainer to show them the same exercise for the 100th time in a row, but they take that appointment because it holds them accountable to showing up to an appointment in the middle of their busy life. And it holds them accountable to, following through with a goal that they've set out for themselves. And in the same way, that's often the type of infrastructure and support that a membership program provides is, you've committed yourself to following through with something. And now you have an accountability partner and you have a community and you have a connection. And that connection might vary throughout the course of your experience with POM. You might feel more connected at one point in time to your personal trainer and your nutritionist, and another time to your doctor, and another time to your coach. But you have that entire support system that's going to rotate around you depending on what your need is at any particular moment.
I think you hit on something really important about that human connection. And as we record this, we're right in the throes of COVID and isolation and lockdown and all of those things. And I think people are really craving that human connection. So I think that's really a key component. But talk to us about how you're doing business with the inability for people to come in and out, like, back in the old days in February, and, how you've adjusted your business to more of a virtual model.
Yeah, it has been an interesting time. And, one of the things that COVID has prompted is the kind of drastic switch into a more telemedicine and tele-wellness service platform. In a matter of just a couple of weeks, we had pretty much launched, over 80% of our services onto a digital platform, which not only, included our medical visits, but also included our personal training, our nutrition counseling, our well-being coaching, and counseling as well, and mental health component. And really, there was this, as we're all experiencing the technical glitches that come along with that. But the fact of the matter is that people wanted to keep that connection, that relationship, hold themselves accountable to the appointments, whether they were personal training or medical follow-up visits. So we've been able to adapt pretty quickly. I've been extremely impressed with our team and all the different ways that they've been able to roll this out, including getting really meaningful, engaging content. We have an on-demand class library that we launched. We have on-demand classes for people to go in live with an instructor so that they can, experience that sense of community of all being, logged into one place at one time, doing different components of their lifestyle, whether it's meditation or fitness. So I think a number of these practices will stick with us. It's also been interesting because certain people were traveling when this started and stayed out of town. And, now these virtual options, we will continue them moving forward into the future to give people more connection points. We've launched entire programs like our stress management program virtually that, has enabled us to expand outside of just our local St. Louis area and really, be a pillar of support to people. And, members have family members in other states that they've said, now can this person join and start on this program? So it's been pretty remarkable to watch not just how our own community has come together and decided that, this is something they want to continue their commitment, and it's part of their daily lifestyle, but how they've also now folded their families into that process as well.
I'm curious, was that part of your initial strategy to get to a virtual model, or was this kind of born out of necessity?
It was an ideal that probably would have taken us a lot longer to accomplish as we started putting these pieces in place. But when you have a crisis, it's pretty amazing what people are able to accomplish in a very short amount of time. So I'm very proud of our team.
It's been interesting hearing, as we've talked in various conversations, hearing how the company has really evolved, because you're not that old of a company, and yet you've come a very long way. And just this talk about the telehealth and what you've done there has been impressive. As we were prepping for this call, you were telling us about how you've really amped up the patient feedback side of things and understanding kind of that service excellence part. And I'm wondering if you can talk a little bit about maybe where it was a year or two ago, where you are today, and how that's really helped you understand what your patients want and need, and how you really innovate and bring new services to the table and maybe phase out some things that are no longer as needed.
Sure. When we opened, a huge part of what we saw in the industry was that two models were really emerging. One was that concierge boutique medicine, ability to access your doctor by cell phone when you want, get a quick call back. That access point was important for clients. And the other component that was important and starting to really emerge was this strong desire to have a whole person functional medicine and integrative medicine approach that brought in traditional allopathic, Western medicine, as well as, other forms of complementary alternative medical therapies and resources and offerings. But neither of those offerings were really together under one place. And I think what's been interesting for us as a company over the last 4 years is to see how people, depending on their external environment, are often sometimes favoring one over another. Sometimes the access point, whether it's just to any provider, is more important. And sometimes, people are really focused on that whole person plan and getting the support needed to, sustain that plan. And finding the balance points of being able to deliver really quality personalized care with a lot of high touch, very accessible, convenient points of access for people has been, a balancing act for our company that in certain times, like right now within COVID, now more than ever, people are really looking for the ability to know that they have an access point to their provider in the event that they get sick or a family member gets sick. And that sense of security, we're always vulnerable to illness and we're always vulnerable to unexpected life circumstances. But in the middle of a pandemic, you're really aware. You're really aware of how vulnerable you are and how many people count on you, whether that's, your kids, your wife, your husband, your business, your employees, your dog or cat that's at home. All of a sudden, your sense of accountability to other people becomes a lot more paramount. And so both that need for access and that need to be healthy and proactive are really prominent right now. And I think that what's unique about POM is that we've constantly been balancing how do we provide both and how do we give people all the access points that they want within a timely, prompt fashion and the pillars of support, but how are we also really pushing people to be proactive about their health and to take control of it. And, I think that that's been that's been the balance point we've been working with since we opened and improving on. And it's the constant dialogue and, really comes back to that each and every time is how can we improve on those 2 points simultaneously to deliver the best healthcare possible.
When you talk about the balance between those things, I think too, and I really love your insight on this, how do you balance that fine line that we're all walking between being proactive, but not so much out of fear, but that whole fear thing adds so much stress, which obviously is not great for your body, but you have to have some element of what's real and what's going on here. So how do you work with your patients to kind of manage stress while at the same time saying, listen, this is something you really need to be paying attention to and be proactive on?
That's a great point because you obviously, anytime that we make huge life changes or life decisions out of fear, often they're not sustainable when that fear wears off. And then secondly, that fear is a stress component. And so, I think the most important piece about that is maintaining perspective. And that was the first piece that we kind of went out with our patients is keeping the perspective in a time like COVID of, yes, we are in a pandemic and we have a highly, contagious and infectious virus, but certain people will be more susceptible or more prone to the adverse effects of it. And here are the things that you can do to prevent, getting it. Here are the things that you can do to, if you do get it, prevent having as severe or acute symptoms as you might have. And, keeping in mind that although there are a lot of deaths, I think that we forget that the reason that we isolate in this way is to not overwhelm our healthcare system, our hospitals, our ICU beds, because we do have a largely vulnerable population of elderly and immunocompromised people. So first and foremost, I think it's about helping people maintain perspective and helping people understand that if they do the things that, help support their bodies in all the ways that they can, they're going to be in a much less vulnerable position if they are to, unfortunately, become infected with the coronavirus. And I think that we also like to share stories of hope to keep that fear and stress down. So, my 90-year-old great uncle had coronavirus. A number of residents in his building and unit, and he immediately started taking supplements, and he said he turned a corner, and he right away he could feel a difference with his energy levels. And he's someone who has always practiced a very healthy lifestyle, taking walks and eating healthy. And I think that that is important to keep down the overall levels of inflammation in your body, whether it's this virus or something else that comes through diet, through exercise, through meditation and mindfulness, and become resilient. And I think that it's really about cultivating that perspective, is to be resilient through healthy practices versus just being reactionary.
I'm intrigued as we talk about this, and I'll play off the last point you made there about not being reactionary. The culture of your organization has been really amazing to watch how it's developed. I think I've known you for almost a year now, probably 9 months to a year now. And as we've kind of gone through different conversations, seeing how it's evolved. And I think the thing that fascinates me most is you're always on the side of learning and growing and understanding how you can do things better. And one of the pieces that stands out is that early this year, you went from this model of understanding, getting feedback from everyone in the organization, maybe on a monthly basis, to structuring that so you're getting it more like a weekly basis right now, and using that to craft, where do we go next? How do we handle the next thing that comes up? And this was before COVID-19 and all the other things, but it's like you got yourself in a position as an organization to react, or I don't want to say react, to respond to what's happening now. And I think that's going to make you stronger going forward. So talk a little bit about what was the logic or the reasoning behind moving from this maybe a monthly review cycle that may be less formal to something that's very formal and very structured.
I think that the most important kind of impetus for that is that service is really at the heart of what we do. As physicians, as nurses, as medical assistants, as personal trainers, or our reception staff, or our cafe team, at the heart of what we do is service. And so striving for service excellence is really, critical to our mission, and to making sure that those relationships that are there are trusted relationships, and that our patients and our clients can count on us for their needs. And so we, just keeping that value in mind, it's important to me that that value is at the forefront of our team leads and our managers and our staff. And I think that it's very easy in an organization, and especially in the time of a pandemic, to get really distracted. There's a lot of noise, there's a lot of worries and concerns. And so it was very important. And it was, prior to COVID, we set this up, and I'm glad that we did, because I think it's allowed us to stay very focused during this time. But we have a service excellence team that's comprised of our different department managers, team leads, and then some of our navigators and various other staff who keep a pretty tight pulse because they have frequent client interaction. And we meet every week, and it's an opportunity for them to bring to the table any things that have been going really well, any new trends and any complaints, because, our clients are vocal, and we give them a lot of avenues to give us feedback. And it's important that we really stay on the top of that feedback, because if there's a small glitch that we don't know about, that only, someone in a back office is hearing about because it has to do with an app or something, we don't know about it. And we also don't know how the rest of the company is addressing it. And so for us to all be on the same page, what really stood out in my observations of our company is that at the heart of service excellence was communication. And it was really important that as long as we were communicating with our clients that we know something, we're taking care of it, here's how we're handling it, that then we had a trusted relationship. And it was that goes in two directions. And so this is really a platform for us to hear about anything new in terms of what's going well, because that's motivating and makes people happy, what's not going well. And then for our managers to update the different teams so that they can bring that back to their departments on, here's an issue that we've identified, here's how we're handling it, so that anybody is empowered in the company to be able to communicate that to a client who brings that feedback or has that question or has that concern. And so these meetings, are really that tool of keeping us on the same page, keeping us communicating with our whole company and communicating with our clients, which at the end of the day is the most important ingredient I see for service excellence.
I love everything about what you just said for multiple reasons, but the internal alignment, making sure that everybody on your team is flying in formation on behalf of your patients is just so critical. And one of the things that we really work on in the business that I'm in with customer advisory boards, we don't want our executive team clients going out in front of their customers and not singing from the same songbook. And, that really makes them vulnerable and also erodes that trust, to your point. And so I think that's just such a great model. And the fact that you are listening and incorporating the customer feedback, the patient feedback is, I think, one of the most important things a leader can do. So kudos for that. As we wrap up, one of the things we like to do is give our guests an opportunity to give a shout out to a nonprofit or a community organization that you may be involved in. And we understand that you started a nonprofit yourself. So why don't you tell us a little bit about that organization?
Thank you. Always happy to have an opportunity to talk about Anthropedia. Anthropedia is a nonprofit organization that I co-founded back in 2004. And it focuses on well-being education. So that nonprofit has a very robust training program that is available to a number of different helping professionals, whether they be coaches, counselors, social workers, people who have an interest in medical education or mental health education. And now we're opening up that platform through different levels of training into college undergrads who have an interest in becoming well-being coaches. And so that coaching program not only focuses on basic lifestyle components of health coaching, which is where in coactive coaching techniques, but we really focus on help people cultivate elevated levels of mindfulness and consciousness and understanding their thoughts and their outlook, which is a very important component of behavioral change. So we train trainers all over the world, and those people really work with clients on a mind, body, spirit approach to cultivating better lives and increase life satisfaction and fulfillment.
That's awesome. What's the best way to find you and Palm Health?
The best way to locate Palm Health is through our website, which is www.palmhealth.com. And from there, there's different access points to connect with a navigator, and that's always the best place to start with Palm.
Dr. Lauren, it's so great to have you on the podcast here. And the things you've shared, we're going to take away from this. And I know we're going to talk about, Betsy and I are going to talk about, because there's some key elements here that we need to be able to bring to other medical professionals and practices, things that you have mastered. And I find that awesome and inspiring because of you being a visionary. We love having visionaries on our podcast, and you definitely hit that category for us. So thank you very much.
Well, thank you. Thank you so much for having me, and also, just for all the guidance in the sphere of customer relations and customer service that you've been able to provide throughout the time we've been working together. So thank you.
Thank you, Dr. Lauren, and thank you, audience, for being here again this week. And we really hope you were able to get as much value out of this conversation as Tony and I did. This was very enlightening and very inspiring, honestly. I just hope so much that this is the wave of the future, because we do need to be a healthier country. And I'm just very excited that these kinds of things are happening in the healthcare profession.
I absolutely just love having Dr. Lauren on the show because she took us to this place that I don't think we've been yet. And we've talked to other people in the healthcare and benefits space, but not like this. She is revolutionary. She's on the edge of what's happening. And, from the start of the organization, listening to what is it that patients want? What is it that they really need right now? And how does she create a model that supports that? So it's been fascinating to listen to this whole conversation and take away. I think one of the biggest pieces that really, really stand out to me, I just want to go back to that, is for them, it's all about the relationship. It's not about the medical transaction. It's not even about necessarily the disease or the sickness it's the relationship. It's the human person that matters. And when you talk about really knowing your customer, that's what it's about.
Yeah, I agree. And I just love people like Dr. Lauren that are so visionary and so not willing to accept the status quo, and just really shaking up a model that's been around for 1,000,000 years. And I really personally get very excited about this because something's got to change with the way we're all living our lives in terms of our health. And I'm hoping that the combination of the pandemic plus these new models for healthcare delivery will really get us to a much better place. And I just feel certain that there's somebody out there that heard this podcast that is going to really get something that could be life-changing for them. And so that's very exciting.
Absolutely.
So thank you again, audience, for being here. And we'll see you next time on the Really Know Your Customer podcast.
Thanks for joining us for this episode of Really Know Your Customer. We hope you gained a lot of value from being here today. If you want to learn more about the work Betsy and Tony do to help their clients thrive, visit Betsy at thecongruitygroup.com and Tony at tonybodoh.com. See you next time on the Really Know Your Customer show.